Before I go to this next area, I'm going to throw out a little statistics from the blackmenheal.org resource that you provided. African Americans are 20% more likely to develop mental illness during their lifetime than their white counterparts. And suicide is ranked as the third leading cause of death in Black men from ages 15 to 24. Now to me, that's surprising. So with this pandemic, where do you see the male African Americans dealing with?
Well, I don't want to skip over the statistics that you mentioned as well, too, because I have an opinion on that. So, just to put out there, gun violence and heart disease ranks higher than that, and cancer ranks higher than those statistics on suicide. Males in general are more likely to commit suicide. White males in general are more likely to commit suicide, even though we know that the teen statistic across races is increasing. There was another number that you mentioned in the statistics. So yes, in terms of the mental health, I would bet, not really knowing, not familiar with the statistics, I would guess that African American males would be suffering a little bit more or struggling a little more. So when you add, we have the whole thing of, the health disparities, not having access to insurance. You're a Black man yourself. How many men do you know, Black men do you know who actually have health insurance? I know I know a lot of Black men who don't. And so having access to healthcare because they can't afford it, or because, most of us who do have insurance, we get it through our employer. If I don't have a job, I have to get it through the market, and sometimes the market rates are high as well. So, right. So health disparities, is a big reason why, we're not able to take as good care of ourselves as our white counterparts. Who might have health insurance or who might not need health insurance because they can afford to pay cash for a doctor or a procedure or medication, et cetera. I didn't
mean to cut you off, but that's another conversation to have also with the healthcare system within America. But go ahead.
Yes.
Yeah.
So in response to your question, my guess is that the pandemic, certainly the unemployment rate went up. A lot of people were leaving jobs. You have to think about the impact, not just to men, but to the Black community in terms of, how did the pandemic impact us who are already, below the bar? Already struggling with access to healthcare, access to food, quality food, access to quality education for our children, you name it, housing. A lot of people, that moratorium, when it ended, a lot of people ended up homeless. A lot of homeless people in our communities suffered during the pandemic. We could probably make a whole laundry list. So right. I think that we are going to have some serious long-term consequences. I think what we're seeing, particularly in Philly right now, is a consequence of the pandemic. A consequence not only of the pandemic, but of the social unrest because of unfair policing in our communities. I think that's what we're seeing in Philadelphia with the increased gun violence. I think, you're from Philly, I'm from Philly. We know that it was shootings all the time in Philly, so what, how accurate is the increase? I don't know. They're talking about the numbers They appear to be going up according to the media, but, is it more attention being put on that, to keep people? I don't know. I think something else is generating because
Right.
we never got so many reports. I can't even watch the news anymore. Sometimes every morning I can guarantee somebody was, they're going to report about somebody being killed to gun violence.
Right.
And I know that was happening before, but it wasn't the top news story.
Right.
So, aside from the numbers, the reality is this is what our communities are facing. I think that the pandemic is directly related to the increase in gun violence. The unfair policing and the social unrest around it definitely making those numbers go up. So what causes that to the Black man in America or in Philadelphia? The cost is going to be more stress, more race-related stress, more because of all of these factors, the employment, the housing, having had COVID. We have people who are having long COVID symptoms now, long haul COVID, what they call it. I know people in my family and some of my friends who are experiencing long haul COVID symptoms right now. And those symptoms are all neurological that they're experiencing, like things like humming. Like the doctors are saying that they're relying on the people who are reporting these symptoms because they have no clue about this disorder. They're getting
Right.
the patients are the experts in it. And so, but most of the long haul COVID symptoms are neurological. So they're going to come out. And I think, in the beginning, you mentioned a statistic about children diagnosed with mental illness. And I'm going to tell you what I know as a clinician and as a social researcher, that number is high because a lot of children are misdiagnosed. A lot of children are misdiagnosed with conditions such as ADHD, and we could probably have a whole nother platform on that. And
Absolutely.
and let me just tell you what I know. Symptoms of fetal alcohol spectrum disorders present themselves as ADHD. And so, but if you can't diagnose a child with fetal alcohol spectrum disorder unless you know for a fact that their mother misused alcohol during their pregnancy. And so, how many of the children that we're seeing in our schools, in our clinics, who are diagnosed with ADHD, and they're just presenting symptoms of fetal alcohol spectrum disorders. Why is that important? Because the medication is going to be different. They might not need medication. They might need some other form of treatment. And so, post-pandemic, whenever that's going to happen, I don't think we're going to see, people are optimistic. I'm not. I'm going to be honest with you. I don't think we're going to be looking at anything called a post-pandemic for a little bit because of the inconsistencies. But, the pandemic definitely we're going to see an increase in mental health, stress-related mental health disorders, I think. In the coming years because of the pandemic and also the social unrest because of unfair policing that happened in our country at the same time.
Right.